Hello and welcome to Radio Waves. I'm your host, Kris Poliquin, and this is a production of Red Apples Media. If you're listening to us, you're doing so on WLBE-790 AM out of Leesburg, Florida. And if you're watching us on Lake Sumter Television, you're doing so on Comcast Channel 13, Bright House 498, and CenturyLink Channel 13. So today, we're going to be talking with Dr. Mike Dwyer from LifeStream Behavioral Center about some of the issues that we're facing nowadays, some of their programs and services that they specifically provide. So Mike, or Doctor, I should say, thank you for coming on the show.
Thank you, Kris. Thanks for having us and providing an opportunity to talk about LifeStream. LifeStream is a behavioral health, mental health center here in Leesburg, Florida. We provide services for the full circuit and recently into Orange County. When I talk about the full circuit, we're talking about Central Florida. That's Lake County, Sumter County, Marion, Citrus, and even down into Hernando County.
Oh, is that right? Wow, okay. What exactly, for our listeners, what exactly is LifeStream?
A behavioral health center, we provide services from prevention all the way up to residential, for individuals with mental illness, co-occurring disorders, substance abuse disorders. We've been around in Lake County since 1971, celebrating 45 years. We started out as actually part of Florida Hospital Watermen at the time, before we have our own current hospital over at 2020 Tally Road in Leesburg.
Oh, okay. Now, was there a need back then for these type of services? I mean, there's always a need, but was there a trigger mechanism?
That's a great question, Kris. Back in 1963, we had the Mental Health Act when President Kennedy signed, and what we wanted to do was deinstitutionalize. So a lot of people with severe mental illness were in institutions all across the country. So what we looked at doing was closing those institutions and bringing people back to the community. So there was the birth of community behavioral health centers across the U.S. In Florida, we have somewhere around 65 agencies, behavioral health agencies. Across the U.S., we have over 2,000 community behavioral health agencies.
Wow, and that's LifeStream itself.
LifeStream itself is one of those
agencies.
And again, we approximately 700 employees work for LifeStream here in Lake and Sumter County mainly.
Okay. So and again, you offer and provide a lot of different services. But let's if we can talk specifically about mental illness. When through the eyes of LifeStream, what are we talking about?
We talk about mental illness. It could be severe mental illness to somebody that's in crisis and experience an acute stress disorder.
Okay.
So we talk about severe mental illness. We're really talking about individuals with schizophrenia, it's a thought disorder, bipolar affective disorder, mood disorder, or a major depressive disorder. And a lot of times these onsets could be early. You could notice it in adolescence, you could have an early adulthood, or a trauma or an event could trigger such a crisis.
Okay, and I was going to ask that. Is it limited to a specific age group? Now, we know it doesn't, but for, I guess, Leesburg area, Lake County, where do you find most of? Because when I talk about mental illness, and again, it's a broad spectrum, anywhere from minor depression, not that there's minor depression, but it could be anything, right? What do we see? If you can say, I don't even know if you keep metrics like that, but in Leesburg or in our area.
We see people of all ages. A lot of folks will say from womb to tomb. Very young babies, we can do an in-depth assessment if mothers are addicted to substance.
Really?
We have 2 schools, alternative schools here that we contract with the local school board. We have many outpatient programs from prevention to outpatient treatment programs right up to our hospitalization, which is our locked, secured unit in Leesburg.
What is the process for someone? Do you find that people walk in on their own, or is it generally their family members that say, listen, let's go find some help? And then once they get to your door, what happens?
So I guess the question, how do people access services? And I kind of just want to talk about the numbers a little bit.
Please.
This is a report here that we put out annual, And it's called the LifeStream Annual Community Report on Fiscal Year Ending 2016. And on that report, people may be surprised that we served last year 23,963 individuals.
So who's we? Is that
We
LifeStream across the country?
LifeStream, that's local in Lake County, Sumter.
And how many was that?
23,963. And we break this down by mental health, substance abuse. We also have a couple other programs for individuals that are homeless or for physical health. A lot of people don't realize that we look at the whole person for person-centered treatment, and the whole health would include person's physical care, primary care, where we have wellness integration networks. So people can get their primary medications through our nurse practitioners and also their behavioral health needs.
And if someone wanted to get information on LifeStream, where can they get that information?
We have a wonderful website, www.lsbc.net. All our programs are on there. There's an array of programs, several buildings, outpatient, but our main hospital is located at 2020 Telley Road in Leesburg, right off of State Road 27. We have an access to care that people can voluntarily walk in and get screened for services. So not all the time people meet the criteria of admitting to the hospital, but there's different levels of care. So people come in, get screened. Then at that time we can provide a brief intervention and then refer to the appropriate and available services in the community.
Okay. Now, shame on me, but I've got to ask this. In my experience, a lot of times, or my impression is that if someone gets admitted, it's usually like a Baker Act or something along those lines. Is that still prevalent nowadays? I mean, is that something that, I guess, how close do you work with law enforcement on this, and are those programs still there?
Absolutely. First responders, law enforcement, EMS, usually the first on scene if somebody is experiencing a crisis. We, at our Baker Act receiving facility, have approximately 4,000 people come through that door, involuntary and voluntary. So that's a lot of people. The average stay in the hospital is about a little over 4 days, 4.2. The Baker Act is our form in Florida as the Mental Health Act. If a person's in imminent danger to themselves or others, we're going to provide some treatment and keep that person safe. We're also going to assess on functional impairment and any comorbidity at that time, mental health, substance abuse, or physical problems that may be contributed at that time. So law enforcement is usually the first on the scene. We have a hotline. A hotline is people can call in. It's a toll-free number. They can talk to a counselor 24/7. If it's a mental health crisis, we can dispatch EMS at that time. We can call them, and we can even do a well check. During the hours of 7 to 7, we have a mobile crisis outreach team. If someone's homeless, we can, the hotline will dispatch that homeless team or the mobile crisis team to see somebody that was homeless in crisis or somebody at one of our clinics or even our EDs. Our emergency rooms is who we've been partnering with lately. In reference to law enforcement, we've been partnering with law enforcement for several years here in Lake County in Lake and Sumter through our CIT programs, and that's Crisis Intervention Teams training. It's a 40-hour curriculum, was developed in the late 80s in Memphis. We call it the Memphis model. For when law enforcement come in contact with an individual with mental health issues, they will help de-escalate and a lot of time prevent any harm of that individual, because we want to try to transport that person help.
Of course. It's not just being Baker Acted, and it's not, let me ask you this. In comparison, and again, I don't know if you have the statistics for it or not, do you find that more people walk themselves in? Or are they assisted coming in the door? Whether it be from law enforcement or family, because it seems like I heard a stat that, 2 out of 3 people who suffer from mental health issues, they don't seek treatment.
Yes. A lot of times people, we call poor insight, or they just may not realize that they need treatment. Typically family members will have a concern of trying to get their loved one into a facility for treatment. And then a lot of times they can come frustrated because under the Baker Act, it's only 72-hour hold. So part of the process, law enforcement could drop someone off at our centralized receiving system. They would get screened by a behavioral health tech and a nurse at that time, and then immediately evaluated by one of our emergency evaluators. If that person meets criteria to go into the hospital, then we would admit that person into one of our units. We have multiple units on our hospital. We have crisis stabilization units, what we call them, one for geriatrics. We have children, CCSU, and Children's Crisis Stabilization Unit, male-female unit at the hospital. And the average length, again, is about 4.2 days. So if an individual gets evaluated within 12 hours, they're going to see our psychiatrist, too, for medication management.
Okay. So what happens after those 4 days? I'm sure some people aren't automatically, wow, that was the best 4 days of my life, I'm good.
It's also the pathway into our state hospitals, because a lot of states around the country have completely closed state hospitals. We still have state hospitals in Florida. We have a treatment receiving facility up in Gainesville. We have up in McClenny, up off of I-10. And we have a forensic unit, too. So if anybody needs extended care longer than 3 days, we would take them to court and ask a judge for that order.
Okay, well, thank you, doctor. We need to take a break right now. But when we come back, we'll continue our conversation with Dr. Mike Dwyer on substance abuse. We'll be right back. Hi, and welcome back to Radio Waves. I'm your host, Kris Poliquin. You're listening to us on WLBE, my 790 AM. Today, we're talking with Dr. Mike Dwyer from LifeStream Behavioral... excuse me. From LifeStream. We'll just leave it at that. Okay, so before the break, we were talking about the... people seeking help or being forced into getting help for mental illness. And the requirement, is only 4 days, basically, until they reevaluated for potentially a longer stay. And I want to talk a little bit about, because I assume that would apply towards substance abuse as well, or am I mistaken?
A lot of people do confuse the Baker Act with the Marchman Act, and that's the mental health and substance abuse acts that we have. The Chapter 394 in Florida is our Baker Act, which is the Mental Health Act. That's up to 72 hours we could hold somebody. If we need to hold them longer, then we petition to the court. And our judges now are coming into our hospital once a week on Fridays, and they also have the deputy with them, and state attorney and public defender, and family members. A lot of time, if a person cannot consent to the treatment at admission, then we'll ask for a proxy or a health care advocate that can consent for them. And then typically we'll only ask for an additional 30 days further stabilization on the unit. Sometimes, though, if people cannot stabilize on the unit, then we can petition for state hospital, and that could be up to 6 months or longer.
Is that right? Wow, okay.
With the Marchman Act, which is a little different, is the Chapter 397, that's the substance abuse. If someone's in imminent danger to themselves or others due to the substance use, then at that time it's a little different. Family can go to the courthouse and ask for an ex parte, and a judge could set a trial date, or he could send out an order for law enforcement to pick that person up, transport them for an evaluation. That evaluation we could hold technically, if we believe someone needs to be there for that, it's 5 days. And then within that 5 days, if we need it to keep them longer and they're not willing to get off the substance, and then we could take them for 60 days longer inpatient. Typically, that's not always used. The person comes on the unit for Marchman Act or detox. I find the majority of our detox are people voluntary coming in, and that's been increasing lately. About 5-10 years ago, probably you'll see a lot of opiates, heroin, and alcohol. Recently, it's a spike in opiate dependence and people coming in. What we do is, in the 5-day protocol, is to detox somebody off of the opiate. So it's a medical detox, and then the psychological detox depends on what that person needs. We could discharge them into residential or outpatient. If outpatient treatment has failed previously, then we're going to look at a higher level of care and maybe do a 90-day residential program so that we could help that person in their recovery and rehabilitation.
Wow. So, again, you have a lot of different programs. And I guess it really does depend on what that person is going through, right? what constitutes substance abuse? Right? Like, there's always, and I'm talking about like the definition, because a lot of times people go, oh yeah, I'll have a couple of drinks every night, but the family member's going, no, you have a lot more than that. You're not. So do you understand what I'm asking?
Absolutely.
Okay.
So you look at as a progressive to dependence. So a lot of times people could experiment with drugs, young teens. I just heard this week the sheriff's going to implement the DARE program. As long as he's sheriff, he's going to continue with that DARE. That's a prevention program.
I remember that. Mm-hmm.
For what we're looking at, that's experimentation, maybe some use. Then it comes to abuse, where you're taking more than you really need to take, and it starts possibly interfering with your daily functions, your work, your jobs, your family, to all the way to dependence, where you need that drug to feel okay. So what you're doing then, you're chasing the drug. So typically when people use substance, I say for two different reasons. One, for pleasure or pain. And as we're seeing lately with the opioid addiction, a lot of times people get some of the regular medications that have been prescribed for them, and they become addicted after that pill that the brain automatically produces, the dopamine and medications to decrease the pain. However, once when you become addicted and you don't have that, then you're chasing that drug. And in 2011, Florida closed the pill mills. We were known across the country as one of the largest.
Right.
The problem is when we enforced that, we didn't really provide the treatment that was needed for individuals. So they stopped the oral pills and they went to street heroin. And lately, as we all read in the news, there's you don't know what you're getting when you're taking a pill that's not prescribed. It could have fentanyl in it, which is 50 times greater than regular street heroin.
And I was going to ask you about that. It seems to me there's a resurgence in heroin.
Absolutely. This is more than just a Lake County, Central Florida. It's countrywide. Last month, our governor declared an opioid epidemic, and we have quite a bit of money here, $54,000 in U.S. Department of Health and Service grants for prevention, for treatment and rehabilitation for individuals. So the legislation is looking at this seriously. We're seeing it at the local level. A lot of times, even youngsters will take a pill and they're not sure what's in it. If it's fentanyl in it, that could kill you. And there's other stronger drugs than fentanyl. Early 80s, up in Alberta, Canada, was W18, which is 100 times greater than fentanyl. So some of the Narcan, that's an antagonist, or it's an anti-overdose medication that the governor also approved for EMS first responders. That could help buy some time to get a person to the emergency room for treatment.
And you were saying that the fentanyl was 50 times stronger than heroin?
50 times stronger.
And that's in a pill form?
That's a pill form, yeah.
We've got to be having a lot of overdoses.
We are. It's spiked across the nation. Just last week, I heard now it's the number one leading cause of death under the age of 50. So it surpassed crashes. What we're looking at is, in U.S.-wide, is 65,000 is the prediction for 2017.
Of deaths?
Overdose deaths. Unintentional, too, because a lot of people don't know what they're taking.
Good Lord. And again, I assume you work very closely with law enforcement on this as well, right? I mean, I know just in the news, more here recently, there's been a lot of the crackdown. The sheriff's really making an effort to crack down. Have you seen large numbers of this coming in, like over the last year, 2 years, or do you think any of this is working? Is it?
Historically, what we've been doing is punishment and locking people up, and that's not working. We have to provide treatment. So if you look at it from a prevention perspective, is probably the key. There's different pathways to recovery. If a person does not need that level of care and we can prevent that, that's the number one. And then if a person does have dependence on substance use, then we got to provide the rehabilitation and the treatment needed at that level.
Now, among some of your programs, we spoke off air about MAT, the medical assistance treatment. Can you explain a little bit about that?
Yes, medical assistant treatment is Well, it's a new program that we're starting, and it's a medication assistant treatment that a person can come to us and get Suboxone. Suboxone is a lot like the actual opiate, but you don't get the euphoria. So it's not the high you get, but it's to maintain a person's safety. So what we would do is we would continue that person on Suboxone, and some people think, well, that's just a drug for a drug. But what we're trying to do is get that person eventually abstinence, and there's a pathway to that. So across the country, we've been doing it in different places up in Maine, methadone clinics. And the key to that, though, is not just giving someone the drug. They need the treatment with the drug. So we have treatment teams, we call access to care. We've hired 5 peers, individuals in recovery for 2 years. So they're doing the AA groups, NA groups with it. We have therapists that are licensed that can work on individuals with unresolved trauma. A lot of times, like I said earlier, people typically use drugs for pleasure or pain. If there's a previous trauma, then we can get that person and get to the root cause. Because typically it's a drug use at that level is an ineffective coping skill to deal with distress. And that could be subjective distress. And when I talk about that, in their world, it's perceived distress that they're chasing that drug.
Okay. They don't get the euphoria from the drug. So how does it work? I mean, I understand the counseling and the treatment and all that. Is it, I guess you're just, the body is slowly...
It has naltrexone in it. So what it does is it binds a receptor so a person's not getting high. So they can feel somewhat normal again, that they're okay so that they can function. And part of the function is improve the quality of life, that they actually get to go out and work, maintain their housing, and sometimes you got to look at work as probably one of the best human service programs out there. Person becomes self-sufficient, they contribute back to the community. If you do not treat the person, a lot of people we talk to, they're going to find the drug one way or the other. If you're looking at a gram, $60 a gram, and you do that day, you times that by 30, you're looking at $1,800 per month to supply that drug use. So eventually, you mentioned law enforcement earlier. Law enforcement, our courts will see that. I worked in a drug court a few years back down in Sumter County, and one of our judges said 85% of his cases were drug-related at that time. So we're seeing a spike in
How many?
85%
Were drug-related.
drug-related.
Yeah, that's awful. That's awful. And when you consider all the speeding tickets, all the reasons that you can go, wow.
So there's different intercepts that we look at. So intercept 1 is what we call working with law enforcement. That's the front end. If we can do prevention and defer people and get them into treatment. The local detention centers, they do have a program called Armor. It's they can treat people in the jail, and law enforcement can put someone in protective custody, and they can detox in the jail. But a lot of times it's better to get them to the treatment facility where we have our peers, we have care coordinators. Care coordinators will work with that person from the hospital. They'll start identifying natural supports and following that person when they go back to the community. People are most vulnerable when they leave one level of care, like residential, going back to the same community, the same peers, the same thinking. They're higher risk to relapse, and we're looking probably at 85% will relapse. And addiction is a relapse disease.
That's all the time we have. If someone wanted to get more information, where can they go again real quick?
Absolutely. 2020 Tally Road. It's LifeStream. Walk into our access to care. We can do a screening. We can tell you all about the programs we offer at LifeStream, the new initiatives that are coming. It is definitely a year of change. We are definitely getting funding that we can help provide the treatment that's long over needed. Awesome.
Well, that's it for our show today. Doctor, thank you very much for coming on board.
Thank you, Chris. And our phone number, 352-315-7878, and that'll get you the access to care.
Awesome. Great.
Thank you.
Well, that's it for today. This has been Radio Waves. I'm your host, Kris Poliquin. We'll see you next time.